in Boston. And now, with no further ado, introducing our panelists right on time. We have Gayshan, Managing Director of CIC. We have Laura Mendoza, COO of Unima, a COVID-19 company. We have Engin, Vrana, CEO of Spartha Medical. And we have Allyson, Cote, CEO of Ocean State Shields. Welcome, everybody. Excellent. So let's dive right in for our participants here with us today. We have over 137, subscribed participants that's going to be coming all throughout the day. So with no further ado, Stas, maybe if you want to give us a quick update on CIC. So we all want to come back to CIC. We love CIC. Our venture studio is based there. We've been successful from there, but we want to come back. So can you give us a bit of a perspective of, how you guys have done, what's next, and how we can help to make this become a reality?
Sure. So, hey, I'm Stas Gayshan. I'm a managing director at CIC, the Cambridge Innovation Center, and also now general counsel at CIC Health, our new spin-off COVID testing company. More about that later. So CIC has been around for now 21 years. We are, we think, the world's largest single shared office space for startup companies, headquartered in Cambridge, but also with locations in Boston, St. Louis, Miami, Philadelphia, Providence, Warsaw, Tokyo, and Rotterdam. And we have a sister not-for-profit called the Venture Cafe Global Foundation, which exists in all the cities I just named, and also in Sydney, Australia, and with some other projects on the way. So a quick thing about CIC, our goal is to create a community to help small companies achieve the scale of large corporations and be able to scale their dreams and their visions and their missions to a global world. So we start with a physical infrastructure built around space, layer on that a social infrastructure built around connecting people, and combine them in a way that operates. And of course, this 2020 has been a really challenging year for bringing people together physically, but we've moved a lot of our events from the offline environment, from the physical space to the online environment. And it's given us a lot of opportunity, especially in crossing the cities. So being able to have somebody from Miami give a talk in Boston previously required a flight. Now it requires all of us dialing into a web conference and being able to share knowledge and ideas across the world. And we know that that's been incredibly helpful. Similarly, Sydney and Tokyo, two venture cafes that meet every Thursday, who are similar in time, but separated by a huge distance globally, have actually been able to exchange information, exchange speakers, exchange panelists, and been able to attend each other's venture cafes because they're in the same time zone, even though they're separated by so much physical space. So while the border closures have separated us in some ways, in some other ways, they brought us closer together. So it's really been a remarkable year. There are north of, that is more than 1,500 companies across the CIC locations around the world. And the majority of that in Boston, Cambridge, but lots of companies all around the world working on very many things, including Alistair and his group. So really excited to be here and happy to talk more about how to connect innovation across the globe. But that's really the role that we think we find ourselves in, and lowering that initial barrier to entry is really critical for the success and scaling of world-changing technologies, which is why I'm so excited about making the world cleaner.
Excellent, Stas. And maybe just before we move to some of the next speakers, what have you guys done in terms of COVID-19? Safety for people who are going there. What are sort of measures, process, and what do you guys need? Is there any need from startups or innovators that you think of?
Yeah, I mean, so first of all, there's a ton of need. I can kind of go through what we've done, but let's say that until we get the world back to operating as it was before, and likely better, I think the COVID's really given us an opportunity to ask a lot of serious questions that we were too busy to ask for because we were doing things every day. So we were asking the questions and saying, is this the right way for a city to be designed? Is this the right way for people to move from point A to point B? But we're too busy also doing those things to immediately change paths. And there are conversations about what is and isn't doable, what isn't expensive. we're asking a lot of those questions now. One of those questions is, how do we work in a place? Is the place that we work, is it home? What are the benefits of that? What are the drawbacks of that? Where do our kids learn? Does the place we work have to be tied to the schedule of our kids' learning? Because it has been historically, but should it be tied together? Should be tied in schedule, should be tied in physical space. So for CIC, as we've thought about it, we mostly closed our offices in February, said, look, if you need something essential from the office, come. We'll minimize the amount of staff, we'll make sure the spaces remove all the pieces of contact, so that we have, where we had door handles, we have foot draws, where we had buttons, we have nanostatic coatings, and all sorts of other things, making sure our ventilation works, making sure our conference rooms are spaced. But then also thinking about, we really want to re-engage back into the community by saying the office is safe. So one way to do that is to, in addition to taking all the other precautions, to offer large-scale testing. And we went out in May and we said, we want to buy COVID testing so that both our colleagues and also our clients who are coming into the office can come in and say, okay, I feel safe because everyone here has been tested. And what we found in May was a really tragic landscape where testing was slow, but also it was too expensive, and also it was really difficult to buy in the kind of quantity that we needed. And we thought it can't be this way. We can't reopen the office safely until we get back to to feeling like the people around us are our colleagues and not be afraid of them. So we started a COVID testing company under the leadership of our founder and CEO, Tim Rowe, who said, look, maybe we can use our size and scale to buy COVID testing better for ourselves and our client companies. And that turned into, maybe we can use our size and scale to actually partner with large institutions to really scale it. So we partnered with a number of folks. Our first laboratory that we started working with was the Broad, just down the street from us in Cambridge. But we now have the University of Minnesota Genomics Center, a number of other labs all around the country. We have opened up the logistics so that our enterprise is responsible for now committing more than 200,000 COVID tests since August, when we started helping people get set up for COVID testing. And we think that reopening the world is really going to be part of, we're going to have to assure safety in the work environment and the school environment. And we're working on that together with a lot of other partners. So we're not doing the COVID testing ourselves. Our role in this is the logistics convener. So we get the labs and the doctors and the clients together, and we remove the barriers that exist in that world. These barriers have allowed us to get most folks tested in under 24 hours with the world's best technology, PCR, and to do that at about a third of the cost of what it cost in May. And so we're growing and we're scaling that business, but most of it has been, if we can smooth out the logistics path for everyone, then the labs and the physicians and the patients and the employers and the schools can all work together in much better harmony. So we're kind of cleaving at that with an axe, and trying to get the costs way, way down.
Excellent. Well, Stas, thank you so much. So that's a good transition to Laura Mendoza, CEO of Unima. So Laura, can you tell us a little bit what you do and the story about your rapid COVID test that you guys are bringing to the market?
Sure. Thank you, Alistair. Can I share some slides?
Yes, you should be able to share some slides.
Perfect. So I'm going to talk to you about Unima. I'm Chief Operations Officer. So today, I'm just going to go through to get the whole idea. Today, to get a test for COVID, as Stas mentioned, you have to go to a clinical trial, to the clinical lab, pay over $100 and wait days for your result. The process is slow, expensive, and annoying, but the most important thing, it is not available for most of the world's population. Yeah, I can change it. So current diagnostic technologies can detect almost any disease known with a very high level of precision. However, this depends on centralized labs with expensive equipment and specialized personnel, which makes it impossible to scale up to an universal access to diagnostics. So to solve this problem, we developed Find, a fast and low-cost diagnostic and real-time disease surveillance platform technology, which will allow anyone, even those with no medical or technical training, to diagnose a disease directly where the patient is without using lab equipment, with results in 15 minutes and with costs that can go as low as $1 per test. So with this technology, we are taking diagnostics outside of the lab and to the place you need it the most, even in the most remote places in the world. So our technology uses shark antibodies, which generate a visual reaction when these detect disease biomarkers in blood, urine, or saliva samples. We print these shark antibodies in microfluidic devices, and the visual reaction is evaluated with a smartphone app, which runs image analysis processes and artificial intelligence algorithms to generate the final result. Automatically, the result, along with contextual information like geolocation date and time, is sent to a cloud server. Our technology has three key advantages. It does not require additional hardware, simplifying large-scale deployment of tests at the lowest cost. It has multiplexing capacities and tests that can be built with many different biomarkers to increase sensibility or to detect different diseases in one test. And the platform generates data in real time. Results of the test are uploaded in real time to the cloud for real-time disease surveillance. Also, data can be shared anonymously to other platforms through an API, and it can be programmed for real-time reporting to results to authorities. This test was developed. So here you have our find antigen test, SARS-CoV-2. This test was developed to be very easy to use even by people without any previous training on its use. In less than 5 minutes, you can detect a COVID infection directly where you are at just a fraction of the cost of current tests. Therefore, it can be used as routine testing in a weekly basis for early detection of cases. So we develop our test for its use at work, at home, or at school with the goal of helping organizations to secure the continuity of their operations by finding infected individuals as early as possible, preventing the spread of the virus in the rest of the organization. We have been running pilots in Mexico with manufacturing organizations. One example is Interloop. Sorry, wait. One example is Interloop, which has 500 employees, and they have been using our test for 3 months so far. And while at the beginning they found several infected individuals who were sent home for quarantine, progressively these cases were decreasing. And in the last month, there has not been any new positive cases, primarily because of the possibility of breaking the chain of transmission. Another example is new pilot with Huevo San Juan, the largest tech manufacturer in Mexico, where 2,500 employees will be tested each 2 weeks directly on the farms and packaging plants and sites out of urban areas. The goal is to eliminate the local transmission of the disease in the workplace, which has affected the productivity of the company. This could represent saving millions in lost revenues due to the pandemic. Right now, our key milestone is to bring our antigen test to the United States. This project started in 2014 in Mass Challenge here in Boston. We know that this is a perfect place for us to launch our test, so we are back. Our goal is to be one of the first antigen tests approved under the Emergency Use Authorization for OTC and at-home use. We are running large-scale validations with patients in Mexico, and in a few days, we will start also in Chile. However, one of our most immediate goals is to run a local validation here in Boston. For this, we're looking to partner with local organizations to set up testing sites for this validation. Also, we are starting contacts with potential channel partners for our launch, including hospitals, pharmacies, and retail. We are currently on the semifinals of the X Prize for COVID testing, which could help us open new market opportunities in the US market. And in January, we plan to raise a Series A round to support our growth milestones for 2021. So in Unima, we have a clear mission, and that's to secure a timely diagnostic for everyone, everywhere. And before we were focusing with a platform in emerging markets, but now we're focusing due to COVID in the whole world, basically. So
Excellent.
Thank you.
Excellent, Laura. So what we found very exciting about this story is that initially the team was looking to develop cheap, affordable tests for emerging countries. And when COVID hit, they shifted this technology, this platform, to bring it to to the US, to Europe, and so on. And so, what's a bit, sort of what now we need, so we think, it works. And, to be able to test it is really simple. We have to just compare it against PCR tests. The test result that the Unima team has is very promising. We just need to do, 100, 200 head-to-head tests. And basically, if that is validated, that's going to trigger everything else needed, to bring this to places like CIC or other places. What also great, it's connected to the software. So basically, you can connect it directly to the tracing app. It just makes the world easy. 15-minute tests. You can have a barbecue, you can have a Christmas celebration, test yourself 15 minutes before the guests are coming in. It's affordable, unlike PCR tests. So that was one of the companies we wanted to feature this morning. Amazing team, hardworking, and also passed with Boston. So Laura, really great. Thank you for presenting this. So then let's move to Engin, who also has a solution that is really interesting, and I will let him expose what this is about.
Thanks a lot, Alistair. My name is Engin Vrana. I am CEO of Spartha Medical. Spartha Medical is based in Strasbourg. And originally, we were developing coatings for medical devices, antimicrobial coatings. And when the COVID hit, we started to think about whether we can do an antiviral coating. And in March, we started working on it. And now we have a spray, which is antiviral and also antimicrobial, so it prevents the secondary infections also. And what we are trying to achieve is complementary to what has been taught up to now. There is one part that you can develop the infrastructure for testing when you enter a place that it can be safe for you. But as you are moving, just before the COVID, as we were moving, you might need your own personal protection. And that's what we will like to offer. Something that you can apply to the surfaces, but also apply to yourself. So it is kind of breaking the wall between the personal hygiene and having clean environment. Something that you can use in both parts. And this has two impacts. In the last year, we have used a tremendous amount of disinfectants, tremendous amount of hydroalcoholic gels. We do not know the secondary effects and long-term effects of these. We will see in 1-2 years. And also there is an indisputable ecological footprint of this. So in the next generation, for the cities, especially populated places, we need more biocompatible, more eco-friendly solutions that will not have this footprint. So this is what we would like to contribute to. And the second part is that the economy just before COVID was going towards sharing. We were sharing everything, cars, working places, houses, everything. And that was setting itself. If this happened 10 years ago, maybe that was going to die and go away. But now it is well established. So we need to find the ways to go back to that life. And one of the ways is testing. One of the ways, as Allyson will talk about, having surfaces which are safe for a long time. And the other one is to have products or options that you can use whenever you want and whenever you think is necessary. And that's where we come in. You are muted, Alistair.
Excellent. Thank you, Engin. So basically, one thing to make it really simple, what Engin is working on. So imagine a table in the C3 workplace, Stas, when there's the co-working places. So a lot of, virus spread of the disease can be done through these surfaces. Well, this type of technology innovation makes it that if a virus hits the table, the virus gets deactivated. So, and then door handles, high traffic areas, payment systems in stores. So we found it was quite interesting, to have Engin today also, pitch his idea and what he's doing. So thank you, Engin. So then let's go to Allyson, Cote from Ocean State Shields. And how is your solution helping us get back to work, get back to business as we knew it before?
Right. Yeah. Well, thank you, Alistair. Good morning, everybody. Admittedly, I'm definitely the wild card entry into this wonderful event today, but I'm really glad to be here. So I am the CEO and co-founder of Ocean State Shields, and my co-founder and I launched this initiative just a few months ago, and we really did it in response to COVID. We are both longtime veteran entrepreneurs in the Providence ecosystem, and we both had a really interesting perspective that when the pandemic hit, we started to see what was going on with businesses and schools and all of these organizations that literally kind of came to a screeching halt. We brought our lives to a halt in order to help people find solutions so that life could continue for the most part, as normal as it could possibly be, but do it in a non-toxic, affordable way that is actually going to be, I would say, productive and help keep things on a positive note. So with that being said, we actually have really kind of a hybrid model because we have partnerships in place with several key components. The first of which is SD Labs. They are a Connecticut-based company that actually manufactured and perfected a formulation a little different than what Engin's company is producing, but it works as a long-lasting antimicrobial surface adherent that can be applied to any interior space. But we wanted to also be able to offer some different things. So we really started to bifurcate and put some strategic partners in place that, one, are locally sourced. So right now, Ocean State Shields, we really only work with Rhode Island and Massachusetts-based companies. So I'm super proud about that. It's very core to our mission that we want to be able to support small businesses and help keep them going as well. But our solutions actually now are rather expansive. We have everything from interior panels that we repurpose from our partner Lumeta Lighting that have antimicrobial properties to things that are actually really on everyone's mind right now, especially in Rhode Island with the Take It Outside initiative. So we have created and developed a proprietary igloo that is using not only fire-safe materials, they're DOT approved, and it has a ventilation system. So for right now, I think we are just about the only provider that can source these and manufacture these products to help keep companies going. And it's worked. We actually have gotten a lot of traction very early on. We have many clients, we have revenue, and we are currently working with the University of Massachusetts College of Engineering. We're developing 2 proprietary products, one of which I'm super excited about. It's actually a very affordable air scrubber that's just about as effective as a HEPA filter, but it costs infinitely less. The second is actually a touch-free tool that has interchangeable components, things like hand sanitizer, a GPS, antimicrobial lighting units. So we're doing a lot, and we're actually trying to help as many local businesses and schools stay open and try to weather this as best as we possibly can. We know that it can be done, and it can be done without the environmental impact that Engin mentioned, but we also wanted to help protect employers' bottom line. So we're doing it with a very mindful eye towards your bottom line, your labor costs, your material costs, and what we've been able to put together is really kind of a comprehensive package that brings you the best possible options in order to continue going while we move into the next phase of all of this. And hopefully we'll be able to reopen and get back to about as much of the new normal as we possibly can. But we've been able to pivot, and we're excited for the opportunity and the challenge. Hopefully I think I just went on and on. I can talk a lot. I get very excited.
No, this is very good. This is very good. So before we open the floor for questions to audience, basically, what do you guys think from what you heard, and maybe Stas, because we wanted to use a little bit the CIC ecosystem, any of those solutions, could be of interest or not, and have, because if we can fix CIC, we can all go back to work everywhere, right? It's sort of the perfect model.
Yeah, thanks, Alistair. So I've already messaged Laura, and she's the first to speak, so I've already messaged her to say maybe we can help on the validation studies. I think Allyson, again, let's also talk. My email is stas@cic.com if you've got any ideas, just send my one. Look, I think there's going to be 2 components of kind of going back to the office. In the short term, going back to the office is going to be, can we keep the office safe? So can we test everybody? Can we
apologies, Stas, we don't hear you very well. I don't know what's going on. Maybe a bit closer to the mic.
Can you hear me better now?
Yes, perfect.
All right. Every once in a while I'm quiet, and then I forget that that's possible, because usually people tell me to quiet down rather than speak up. There is so look, my thought is, in the short term, going back to the office is linked around us having physical safety and understanding that the people around us aren't going to get us sick. So that means everybody wearing masks, keeping a distance, sort of air control and others. In the longer term, it's really vaccines and getting to a level where COVID is a distant memory rather than a constant presence. We're probably some months away from that. It looks like the vaccine data is coming out very encouragingly, but of course we won't know until they're approved and distributed. We do know that there will be some significant distribution challenges. At least the early vaccines that are getting approved have to be stored at very, very, very cold temperature. They have to be in vials with 20 doses. So you're going to have 20 people lined up, because once the vial is brought from frozen to room temperature, it has to be administered within a very short window of time. So there's a big logistics challenge in front of us with vaccine administration and getting it out to people, so that whether it's Moderna, Pfizer, any of the GlaxoSmithKline, any of the other vaccines that are coming out, all the early vaccines will have a fairly complicated chain. I think we can expect that the actual logistics of the vaccine administration, getting it out to billions of people around the world, getting anything out, getting Coca-Cola or Pepsi out to 5 billion people is a complicated undertaking. Getting vaccines with a cold chain and distribution chain and administration issues out to everyone is going to be a big global challenge. But I think one that, I think if 2020 was the year of stay at home, 2021 will be the year of vaccine distribution. That will be the big challenge of 2021. But then once we get back there, and it's really critical, because we can't just stay in our homes for the next year. For Allyson, what you're working on, for Laura, what you're working on, for Engin, what you're working on, be part of a comprehensive package. I think we're in a world where we don't maybe need as much. We have to be careful, but we know that there's not a ton of transmission through touch for COVID, but that doesn't mean other things don't transmit through touch. So making sure that touch surfaces are clean and usable is actually going to continue to be critically important. I don't think we've spent a ton of time before 2020 thinking about disease transmission in the workplace. It's been kind of like a casual thing, like, don't come in if you're sick, unless you have a project that you have to work on tomorrow. In that case, come in, but don't sneeze on anyone, please. Right? I mean, that's what people told you last year. And, I think we can imagine that behavior will no longer be the case. That people will say, if you're sick, really stay home. And stay home until you're better. Don't take cold medicine and come into the office. I think we're all kind of going to think about the intersection of our health and our workplace and our home very differently going forward. And I'm really excited about all the products that are coming out to make us much more aware of it.
Excellent. So that's why, I think from being a user or client of CIC, I think having these types of, being able to do vaccines on site, thinking of things like this, having, maybe a test like Unima, where, I can test myself or know people are tested, maybe the community is tested, you can see information. And what do you think about, do you guys already use, so it'd be interesting to know, for Allyson and Engin, does it already exist, solutions that you use for the cleaning of the, office space and walls and, that are.
Yeah, it's actually interesting. Where I am right now is one of the larger co-working spaces in Providence. It's Sprout Co-working. And this is where we're headquartered out of. And actually the entire interior of Sprout has been treated with one of our products with electrostatic spraying, SD90 Plus. So I think there's been a really, an interesting shift. I think these products, what Engin and I are working on, and Laura, I'm really excited to learn more about your test because I think that's amazing, is that what we're going to see right now, I think the challenge we're facing is kind of an adoption scale. So people are so used to the brands that have always kind of been recognized as being disinfectants like Clorox and Lysol. And, those for their purposes can be effective. But, what we're doing is something that's truly innovative. And this is a completely different category. It's even recognized with the EPA as being a completely separate category than these other products. So a lot of it is awareness, and I am pleased to say, hopefully, and this will be something that is a continuing trend, is that once people really kind of understand what the product is, its benefits, the fact that it is so much better for the environment, it is so much better for them personally, for their families, for their coworkers, that they're much more apt to embrace it. And ultimately, it saves, a ton of money over money that they're already spending, that at this point, for a lot of companies, in particular the hospitality industry, they simply do not have. So we're really trying to do a very preemptive strike to be able to keep them afloat and do it in a way that really makes sense, but that is kind of pushing innovation to a different level.
To add to that, for example, there is a distinction between cleaning and coating. When you clean a surface, it is clean for that moment. 10 seconds later, you have no control over what will happen. But if you have a coated surface, you have another level of security. Same goes for all kinds of physical barriers. A mask, a surface that will keep things away. This is a passive protection. If you have active compounds that can actually kill bacteria and inactivate viruses, that's a different kind of protection. And the next 10 years, 15 years, I think if these products are safe and if they are not dangerous for us, they will get into our lives more and more. And giving the people the choice of selecting how they protect themselves, for me, is an important thing, particularly for kids, particularly for aged people, particularly for people who have certain diseases, chronic diseases. So I think this is very important. This is one part of the advances in materials, and it will go hand in hand with the developments in the cities.
So Engin, question for you, Engin. So what types of viruses does your solution work with? Does it work also with the flu, with, other than COVID-19?
Flu, we haven't checked yet. It works with HPV. We have checked with HCV. We have the luck of being very close to the Department of Virology in Strasbourg, so we will continue checking. It is a physical interaction with the virus. The inactivation comes from that. And what we are doing on top of that, as a kind of early response module, is we are developing models based on machine learning that can link the properties of the coating with the surface structures of the virus. So next time when we have a sudden pandemic again, maybe not at global scale, we will be able to develop a formulation which is much more effective for that specific virus than the others. So this is where we are trying to go at.
And maybe final question again from my end for you, how are you envisioning your solution be used, for example, in a place like CIC, a co-working place or corporate headquarters? How are you envisioning it being used?
The way I see it is that you come in, you have your spray, you put it on your desk, and you look around you, you see how many people are dead, and if you feel like, you put it in your mouth, you put it in your nose, and whatever you need, it will work like that. So you will decide when you need the safety. Wherever you can go, when you feel that you need an additional level of protection, you put it.
So basically you're putting it in the nose, in the mouth, and if the viruses comes in the nose,
it will prevent the... Exactly. It creates a layer. It is not just for that moment. It is not like a drug. It creates a layer and it stays there and it acts like a barrier for a given amount of time. It is not forever, but for a given amount of time. And with respect to the utilization, we will be able to tell you how long is that time.
Excellent. Excellent. Thank you, Engin. So we're going to open the floor. Please ask questions, everybody. I have a question maybe for Stas on transportation. So obviously, and myself, I'm one of these people, coming to CIC. So we can come with our car, we can come with the tube and so on. So, but obviously, I'm not completely comfortable in taking any public transportation this day and age, and so what is the thinking there, to from a standpoint of transportation? Today we're going to talk about e-mobility. I know Elon Musk has this amazing ATV, electric ATV. For me personally, that would be a great solution, coming to CIC with my electric non-polluting ATV, park it in front. What do you guys are thinking of reassuring people to come with the public transportation?
Yeah, so look, I think one really incredible achievement that moving to electric powered mobility gives us is a range of flexibility in vehicle shapes, sizes, and configurations that simply is hard to do in sort of gas-powered mobility. So everything from scooters to electric bikes, to ATVs, to cars, to tricycles, to motorcycles. I think we're going to have a very different series of shapes coming. So, and the idea that you need to get into a vehicle that, you know, let's say if I weigh 200 pounds and the vehicle I'm in weighs 5,000 pounds, we have to mobilize 5,000 pounds of weight to move 200 pounds of weight. That seems to be an inefficient bit, right? So the transportation is ripe for change. And by the way, I think one thing that I'll tell you, as somebody who came to the US as a little kid, as an immigrant, and have spent a lot of time traveling, one of the questions that always gets asked about the US is, why are we so car-centric? And so far, you know, a lot of the answers have been, okay, look, we need parking here, we need parking there, okay, I hear that. The pandemic has, walk down Newbury Street, walk down the North End, walk down Moody Street in Waltham, has reshaped the physical geography of our street. We still have to drive there. In fact, we're taking less public transit than we were before. But somehow we've also found a way to remove the parking spots out of the street and insert outdoor seating in restaurants and wider sidewalks. And what I keep hearing from friends and family is, one, why did it take us this long? And two, we all know that's not going anywhere, right? Like, no one's going to want to go back to Newbury Street and say, you know what Newbury Street needed more of? Parking. And you know what it needed less of? Outdoor space. All right. And it needed narrower sidewalks and more cars darting, right? Like, and I say this as a driver who lives in the suburbs outside of Boston, but like, I'm happy to walk 3 blocks if it means I don't need to worry about being run over on the way to the cafe. And so, you know, I think we're seeing this. The same thing affects the office environment. So getting to the office environment, there are 2 fundamental questions about the commute. One is, what is the mode of transport that I use there? And 2, how often? Right? The how often question, also the where from question, by the way, is critically important, but the how often question actually defines where from. Because if I'm coming into the office, if the world of the office is more flexible, and I don't have to think about work as a place where I go 9 to 5, Monday to Friday, then the work environment, which was already global before the pandemic, right? So all of us who work with people in other countries recognize that my 9 a.m. is not your 9 a.m., right? So I, of course, I'm going to be able to do something differently, because if I need to talk to somebody in Singapore, my 9 a.m. is their 9 p.m., right? So we already have to work in that world. But if we're working in that world, if we're not constrained in office with the people just around us, then that remaps how we work, and it also remaps where we do it. And so what we're seeing now is people are saying, okay, look, I'm probably not going to have a physical designated desk at my office to go back to anytime soon. If I can, I want to go to the office. I want to see my coworkers. There are some things that are much easier done in person, but there's a whole host of things that we found out we can actually do from home. So maybe I'm not going back to the office 5 days a week. And if I'm not going back 5 days a week, the advantage of a flexible environment where I can come sometimes with the whole group and sometimes just by myself, or sometimes not at all, actually is overwhelmingly better than making a dedicated agreement to a single place and not being able to move from it. And having a network of places to work around the world is more effective as well. So I think we're actually going to see a massive shift towards flexibility generally, and it's driven by transportation, it's driven by traffic, right? We're asking the question, like, if I don't have to go to work at 9 a.m., I probably don't have to think that much about traffic, right? Because in most cities, traffic is beginning of day, end of day. And if beginning of day and end of day aren't the same for all of us, then maybe traffic is, that's one way it gets solved. So maybe we can use more individual transportation. We can think about how we can clean public transportation so that public transit is safer. But one of the ways that public transit will be safer is if we're all moving in, not all in at the same time, all out at the same time, densely packed. But if we're moving in different directions throughout the day at different times of the day, and we're going to have to ask a whole bunch of questions about what does that mean in terms of operating hours, right? It's a constant question in Boston is how often is the city open? We've heard even, Mayor Walsh say, look, if it doesn't make any sense that if I'm working with somebody on a different time zone, that I have to live in the East Coast, in East Coast time, and my work shuts down in East Coast time, and my train shuts down in East Coast time, if I need to speak to Singapore at the end of the day.
Excellent,
So
Stas.
lots of changes coming.
No, but I love all these visions, and I hope we can implement them, sooner than later. And that's the objective of today, is to discuss, how do we actually concretely make the change happen. It's great to have ideas, but let's make it happen. So thank you very much, Stas. So now we are on time for questions. So any questions from the audience, please? This is for you, for everybody. So if you have any questions on the rapid COVID test, on the bio coatings, on the different solution for entrepreneurs and shops, the igloos and or CIC workplaces, it is now. Please don't hesitate. This is for you. We want this to be a community event. So go ahead. We have one question. So you talked a little bit about it, Stas. In a few words, what's the future of co-working? How do you see the future? You sort of alluded to it in the last question, but what's the vision? Is it meeting rooms that we can book, and what's sort of the vision you guys are thinking of?
So I think we're going to go back to a world where we connect to one another with physical density. That's not really a question. It's just a question of how do we get back to doing that safely. I think there's still something about working together in person that is more than working together not in person, and working together remotely. There are some advantages to remote, there's some advantages to the physical space. So then our goal is to say, okay, how do we make the physical environment safer? And it shouldn't be a choice between your work or your life. Like, that's an outrageous choice, of course, your life over your work. But then if we can make the choice safer so that you don't have to choose between life safety, then we think that's pretty good. We just need to make sure that environment, the built environment, reflects that.
Excellent. Well, thank you, Stas. Any questions from the panelists to each other? Any things you guys want to exchange on together? Any opportunities you see? Make it happen right here.
Alistair, I also want to share something that I think it's important. Like, you probably guys remember that 100 years ago, there was a Spanish flu that happened, and it was devastating for the world. And this is the first time, not the only time, but at this scale, a new pandemic has affected us. This means that this is not impossible for this to repeat itself. It will surely repeat itself. We don't know when, and we are very, very lucky that COVID has such a low incidence, that it's not killing children at the same scale as old people, etc. But it's a very good opportunity for the world to actually train itself on how to really respond correctly to a pandemic. And that we are very, very lucky that COVID has happened in that sense, the way it has, because most of us, the majority of us, are stuck at home, learning stuff, doing that, but it's really not as catastrophic it is catastrophic.
Yes.
It's just not that terrible.
It could have been worse. And actually, you're right. There's an article in Nature that explains that climate change, which we will be talking about today, is responsible also for the pandemic, because animals retreat in the backs of forests, change habitats, find new viruses that have evolved. And then since we get close to animals, we eat them, and so on and so on, we catch this. And you're right, it could have been far worse. It could, with the challenges we're all facing, this could reproduce more and more, and it could be like a norm, right? So actually being ready, you're right, to remind us of this is important. And in Asia, one thing also I want to add, we have all these cities collaborating. I think Asia, or some countries that had been hit in the past by these types of events, seem to have better managed this. So what can we learn from them, right? I don't know if we could have maybe a next event where we actually bring some countries who have been living this. So we just copy paste, like we don't need to reinvent the wheel. I'm pretty sure a lot of the processes we're talking about today are kind of already somewhere in place somewhere else. And I think that's the beauty of today, the digital world. We can, collaborate, exchange, and we should learn fast, because, you're right, Laura, it could have been far worse, and it could be worse tomorrow, right? What if the virus evolves, right? The vaccine is one thing, but some people are saying, it's not necessarily the solution, right? So, so basically, thanks for adding this, Laura. That was very important indeed. Any comments from the panelists you guys want to add?
I just want to add something to it. I think one part of the crisis is our healthcare system. We are seeing that the infrastructure we have is not enough for extreme cases. So everything we talk about, the coatings, the testing, the management of the situation, I think in the next time we should be able to push these all together one side, and the other side we need to imagine new ways of incorporating the health system in our lives. The hospitals should stop being something separate at the corner. We go maybe 2 times, 3 times in our lives. It will come closer to our working places. It will come closer to our homes. It will be different. And again, this is an opportunity to think about this and take the necessary steps so that in the next time we will be much more prepared.
Excellent. Thank you, Engin. So we're about to be on time for the end of the panel. Anything else, final points you want to bring, Allyson?
No, again, Alistair, thank you for inviting me. And, just to echo the sentiments of Laura and Stas and Engin, it's actually, COVID actually has been really a harsh lesson, but I think also a good one. And one takeaway that I've actually been really kind of, I would say, touched by is the fact that the support and the willingness to collaborate across industries, across niches, across different levels of expertise has really been unparalleled. So this was a really harsh wake-up call for all of us. But I think that this pivot has really kind of forced us to rethink how we do things. And it's really been amazing how quickly people have been wanting, how quickly they are willing to, go forward with things and look at different ways of doing things and modifying things to try to, to protect the future and be able to get us back to where we need to be. So as bad as a pandemic can be, there are occasionally some pluses, and I think we have seen a few of those, and hopefully we'll continue to see more.
Excellent. Allyson, thank you so much. So I think this is perfect words of hope and positivity to end the panel. Thank you, everybody.
Thank you.
Looking forward to be back at CIC.
Thank you.
Our panelists.
Thank you, Alistair.
Thank you, everybody.
And a better world to come. So we'll be in a better place when all is said and done.
Absolutely. Thank you, guys. Thank you, everybody.
Bye.
Well, now the next panelist is going to be joining. So thank you to our panelists here. Okay, so basically, thanks to our partners who are bringing this event for us, with us. We have many amazing organizations that are changing the world, fixing the world, and trying to improve things. So thank you for all these amazing organizations for being with us. The next panelist, and we're going to be starting at 9:10, so take a break. You can grab a coffee. We have Scott Miller, VP Sales, based in Boston for USA, for ChargePoint. He's going to talk about the future of electric mobility. This is extremely exciting, everyone. So bear with us a few minutes. So if you have a headset on, the music might be a little loud. If it is, feel free to tell us, in the chat, and we'll be more careful on the next ones. But we wanted you to wait for the next panelist to come with a bit of music on there. We'll start at 9:10. Everybody, speak to you soon.